Welcome back. For the past 2 years, amid the approach of autumn, health experts and media outlets alike have speculated about the possibility of a twindemic, that is a simultaneous onslaught of influenza and COVID-19. For more on the prospects of a twindemic this year, I have Professor David Kwak from Soon Chun Hyang University. Professor Kwak, welcome back.
Good afternoon. Thanks for having me.
I also have Professor Sohn Ho-joon at Seoul National University live on the line. Professor Sohn, it's a pleasure as always.
Hi, Sunny. It's good to see you again.
Professor Kwak, we'll start here in the studio. Let's start with your prospects of a possible twindemic this year. We've covered this over the past 2 years, each time, this time of the year. What are your thoughts with regard to twindemic?
Right. My prospect actually changes a little bit this year, different from the last 2 years or so, primarily because we were sort of retrospectively seeing lucky the past 2 years because there was such heavy measurements of social distancing guidelines, and some of the countries around the globe actually completely blocked themselves from the rest of the world to actually keep it contained so that no particular virus was able to spread throughout the nation, also blocking the possibility of twindemic that much further. But this year, as we have seen with our own government, we have downgraded the level of COVID-19 from the primary to the secondary. And also we have sort of loosened ourselves in regards to social mingling and social distancing guidelines and whatnot. So, and also the fact that we have just been through a huge wave of the pandemic, possibly going through the April to March through possibly June of time. Exposing ourselves to the weakening of immunity against COVID-19, but also the fact that having not been exposed to the influenza virus for the past couple of years or so, I do think that there is a chance that we would possibly see twindemic. And I dearly hope not that we would go through such an experience. But there's also the fact that I see that there's a greater chance of the nation actually going through more of an epidemic with influenza rather than the COVID-19, because with COVID-19 we had such a massive wave of infection and transmission, and almost 90% and plus of the population have been vaccinated quite strongly against COVID-19, and also the fact that we have actually long-lasting immunity, not just primarily from the vaccination in regards to the antibodies, but also the T cells and B cells that still remain in our body that have the memory of immunity against COVID-19. I would hope and think that we would be better protected against COVID-19, hopefully this year and the early parts of the next year, as opposed to influenza, because we had such less exposure to that. I think there will be a greater chance that we might actually see slightly or relatively larger peaks of influenza during the winter, which still sort of permits us to be vulnerable to seeing a twindemic.
Right. And Professor Sohn, Professor Kwak's opinion about a possible twindemic is also shared by health authorities here. And that being said, though, one theory I understand, known as viral interference, completely rules out the possibility of a twindemic. Do you care to elaborate?
Sure. So I would caution a little bit that theory is a theory, right? And I would be a little bit cautious in saying ruling out. But there are some evidences that support and some evidences that don't support. First of all, the viral interference is sort of known as virus-virus interaction. It's a phenomenon in which two viruses interact within a host. So same person gets infected by two different types of virus, and it affects the outcome of the infection of one or the other. Then the infection of the first virus either it could enhance or reduce the infection and replication of the second virus. So at the population level, there are some examples that supports this, such as in 1960s, and there were polio vaccination campaign that has shown to cut down respiratory infections. When there was a swine flu epidemic in Europe in 2009, there was very low levels of rhinovirus epidemic at the time when it should surge. Also in Gambia, that people have looked at the surge of COVID-19, rhinovirus, and influenza peaks. And in Gambia, there were no social distancing measures, so they naturally showed when these viruses peaked at different points, it's essentially supported that these viral interference may be at play. But at the end of the day, some biological studies have shown that which virus you get infected first is also an issue. So basically, when you get infected by influenza virus, it kind of limits the replication and the immune response for COVID-19. Whereas if you're infected by COVID-19, but later infected by influenza, they would still experience the symptoms and illness of the influenza virus. So ultimately, I think there are not a lot of solid evidence. We're still speculating. And as I mentioned, it's theory, and theory is never perfect in reality. So we should still be very careful, but there are some suggestions that there's not a possibility of twindemic at this time.
Right, I see. And moving forward then, Professor Kwak, countries in the southern hemisphere, including Australia, had a very rough flu season, especially those below the age of 18 were particularly hard hit. How do you explain this reality? I mean, why were the young so much more affected than the adults?
Right. Let me actually begin by noting the importance of what happened in the southern hemisphere that we have to take lessons from. The important part is that the southern hemisphere sort of works as a testing site where we see the efficacy of the vaccinations that we give against influenza, whether or not they match very well against the transmitting virus in Australia, New Zealand, and etc. This year particularly, they've observed that the epidemic of influenza actually started about 2 months earlier than usual. And we're actually comparing ourselves to the average of the past 5 years or so. So this is not exactly us comparing only to the past couple of years where we were completely locked down against COVID-19. So it means that there's a possibility that the influenza this year may actually begin possibly earlier, or may even become more severe in the sense of affecting a greater population. They've actually reached higher peaks during the epidemic in Australia, and they've reached about 200,000 and more patients being admitted or being confirmed of influenza, and many cases of having people admitted to hospital and going to ICUs and whatnot. But also, very, very recently, just back about a week or so, the newest data actually suggests that now they have prematurely also reached lower than average the numbers of influenza infections. So I would have to rather stay neutral about the fact that whether or not we are also going to get as much of the dire consequences of influenza infection. Now, that being said, the main reason we suspect that people under age of 18 are more heavily affected is because also due to exposure differences. As I've mentioned before, with adults who are older than 18, they've had greater time of experiences that might have exposed them to influenza viruses before. So not only through antibody levels, but as I said, with the immunity, we have T cells and B cells that have memories for much longer time against certain types of viruses. Now, people who are younger than 18 obviously have, relatively speaking, much less of the exposure, less of the immunity building against this particular virus, so they might have been affected more heavily because of that, but also the fact that now we're lifting gradually of these social distancing guidelines, and obviously children who are younger than 18 years of age would have much better chance to mingle themselves because they are now starting to going back to schools and they're mingling better. So there might be the social factor too.
Right. And Professor Sohn, essentially then, perhaps getting a flu vaccination would be one tangible option to staying safe amid the existing threat. That being said, when should we seek to be vaccinated against influenza? And what are some words of advice, perhaps, as amid plans to also launch the bivalent vaccine campaign?
Yeah, so I want to just first clarify that we shouldn't be thinking that getting flu vaccine will protect us from COVID-19 or its variants. Vaccines are very specific to their disease and illnesses. So, and schedules for being vaccinated for flu should not be changed based on whether or not bivalent vaccine is available or not. There's very specific schedules for that, and I think we should just follow that schedule. There's also studies that have shown that co-administration with COVID vaccines, with flu and other vaccines, does not increase the side effects, adverse events. So therefore, in the US, they are recommending that when you are scheduled to be vaccinated for flu, and at the same time, that's also the time that you get boosted, either with the new bivalent vaccines for COVID. That's what they should be doing. But in terms of scheduling and timing of the bivalent vaccine is very specific, at least in the US, that it specifies at least that single booster should be made 2 months after the completion either on the primary vaccination or receipt of the most recent booster dose. And then if you have recently been infected by COVID-19, people should defer getting the bivalent booster shot at least until you recover from the illness. And prefer that the delay of this by 3 months can maximize the potential benefits of the vaccination. So again, the clear message is that if you're scheduled for both of these vaccines at the time, consequentially, you should be vaccinated with both. The timing of the COVID-19 vaccine, the bivalent vaccines, should be based on when you had your first or booster shots or when you have previously experienced the illness.
Right, good to know. Professor Kwak, on the subject of COVID-19, I understand the symptoms of this virus, so to speak, the infection itself, has changed in the course of the pandemic. Do correct me if I'm wrong. I understand digestive difficulties may be the first sign of an infection right now, and symptoms like shortness of breath have become less prevalent as the virus mutates. What are some of the more common symptoms now then?
Well, I would actually like to try not to confuse our viewers at the moment. I still am seeing the majority of people who are being confirmed with the case of COVID-19 are still coming up with respiratory symptoms rather than digestive or gastrointestinal symptoms. From the beginning of the pandemic, even with the original strain of SARS-CoV-2, we had a very diverse symptoms that came out of different people. Among the younger children, we often saw gastrointestinal problems along with the respiratory symptoms. But with also the Omicron variant of SARS-CoV-2, we are still seeing a lot of sore throats. We're still seeing a lot of heavy myalgia, muscle pains, joint pains and whatnot. A lot of people are still coming up with heavy coughs and shortness of breath. But on top of that, we are also seeing more commonly than before people who are coming up with gastrointestinal symptoms. So let's not generalize the symptoms, whether it has shifted from it being more respiratory to gastrointestinal, but it's still respiratory. But a lot of people are also coming up with gastrointestinal symptoms. So let me put it that way.
Right, understood then. Professor Sohn, back on the subject of vaccination. Over in the US, Dr. Anthony Fauci has spoken about the likelihood of an annual COVID-19 vaccination program. Do you share this outlook?
Sure, I do in some ways share this outlook, and I think we should be looking at why this recommendation was made, and these were based on several important considerations and assumptions. First is obviously there's waning immunity issue, right? So even if you're vaccinated or been infected by COVID, the immunity levels die down, even though there are longer-term memory T and B cells that give you immune response. And then it also assumes that there is no dramatically different variant than Omicron subvariant that should be rising. And then while we can't rule out the issue of continued rise of the variants, the development of the vaccine finally has caught up so that the currently available bivalent vaccine now covers most of the Omicron variants. So, and with these updated boosters, the bivalent vaccines are in fact designed to add protections for these subvariants of Omicron as well as the original strains. So, so based on all these considerations, we expect that that the annual vaccination should be able to prevent us from either the infection, but also towards the experiencing more morbid and serious illness due to COVID-19.
Right, and staying with vaccination, Professor Kwak, North Korean leader Kim Jong-un has reportedly spoken about a public COVID-19 vaccination program starting in November. What are your thoughts on the timing of this planned inoculation, especially given our fears about a possible twindemic here in the Northern Hemisphere?
Well, I think it's better than not. Obviously, there have been numerous studies that prove that people who received vaccinations either after or prior to the actual infection were more greatly immunized against SARS-CoV-2. So for those people who are in North Korea to receive inoculation finally would also be additively protected against SARS-CoV-2. So I would applaud their decision to finally go ahead and implement the national level of inoculation. Also, considering the possibility of twindemic, North Korea happens to be one of those countries who block themselves out from the rest of the world from the intrusion of different types of or different variants of COVID-19. So a lot of the population, I presume, would now currently be not immunized, not exposed to both influenza and SARS-CoV-2. So there is, I think, that much greater chance for these countries who have not been exposed to these two particular viruses to finally get them if they start opening up. So I think it'll be wise for them to actually start considering vaccinating themselves for both of the viruses, if not at least one of them. Mm-hmm. So their decision to finally go ahead and do the vaccinations for COVID-19, I think, will be a wise choice at this moment.
Right. And beyond this region, Professor Sohn, China and India have approved nasal COVID-19 vaccines. Do tell us a bit more about these new preventive alternatives against the pandemic.
Yeah, so we should first note that there are about 100 similar vaccines in development. These vaccines essentially work by triggering the immune response at the point of COVID-19 entry, which is on our nose and mouth, and essentially hopes to stop the virus from entering other cells before it spreads into other cells of the body. So, and these vaccines are developed with the aim to overcome some of the limitations of intramuscular shots, which are the conventional vaccines that we have it in our arms, that has shown some limited immune response at a virus entry site of our body. So scientists so far have shown that these mucosal or nasal vaccines have shown high levels of immune response in our mouth and nose, but it doesn't necessarily mean that it will prevent the infection as well. And ultimately, these studies currently have challenges in measuring the efficacy of the virus, first of all, because we don't, first of all, know what is the appropriate level of antibody response that prevents the infection. And then the second is that we don't have a lot of people who can serve as controls, so who have not experienced COVID-19 at this stage. So we can't really have a counterfactual comparison of those who are vaccinated and not vaccinated, and in terms of measuring the prevention of the infection. But ultimately, I think the goals of these vaccines with COVID-19 has been more or less reducing the disease morbidity and burden by preventing not the infection, but preventing progression to more severe illness. So on that front, these development of these mucosal nasal vaccines are very promising because administration is much easier and simpler. So hopefully more products can be approved so that we have more tools to fight the COVID-19 pandemic.
Right, of course, I'll keep my fingers crossed for that. Professor Sohn, as always, thank you very much for your time and your thoughts. And Professor Kwak here in the studio, thank you very much for your insights.
Thank you.